problems at hand. Now, let me go straight to Save My Child. Save My Child is a social enterprise involved in maternal and child health financing. Now, we've, over some years, since 2015, we conducted local pilot phases of our work to assess some of the problems faced by pregnant women and expectant mothers. Now, with the aspect of maternal and infant mortality, we realized that it is medically related, because when you discuss with some doctors and you find out that reasons why women die, or reasons why women, pregnant women die with babies, or sometimes they deliver and they happen to lose their babies at the early stage, which is less than a year. The causes are always centered around medical complications. But this is not the approach we took, because during our study for about 2 years, 2015 through 2017, we covered 8 regions in Cameroon, where we worked with over 5 districts, and we realized that more of the cause is access to medical facilities. Most of the women, they have these complications, but they are not identified at the early stage, and they grow with it because of poor medical attention, follow-up, and others.
And probably because of money.
That is the essence. That is why we created Save My Child. And when we discovered that the reasons why the women don't do their antenatal and follow-up, it is not because we have poor medical systems or facilities. No, we have very good medical systems and facilities in the country. I can assure you of that. Now, as the problem now is based on the cost of healthcare. It is usually very expensive, especially for women who have low income, and they cannot
those who don't
really
even have an income at all.
That's a problem, and they cannot really pay for healthcare and others. Now, basically, when we started the work, we realized with some women that there are some paraclinical examinations which are set forth, a set of tests which pregnant women are supposed to do. They range from about 13, which if a woman conducts this test, she's able to identify the risks associated to her pregnancy and other eventual complications. But because of financial difficulties, when the women go to the hospital, they do what they call a selection of what they can do. They will basically do maybe urea, and maybe once they can do echography once, and they believe that pregnancy is just to get pregnant and deliver. But that is not the case, because with the other tests which are in place, they can easily identify the risks and the challenges and how to treat them in time. Now, because of these financial difficulties, the women cannot really do all the tests and receive proper care, you see. So medical doctors on their part, they've done so much work to see how they can advance free schemes and programs to enable free screening to some of these pregnant women. And the Ministry of Public Health have worked on the cost of healthcare and also set up different programs which enable pregnant women to have access to medical facilities and also reduce the cost of healthcare. But now they cannot make healthcare to be free.
Of course,
in
Cameroon,
health is very affordable. You see, the cost
it's affordable, yes, but it's still expensive.
It is true.
For some sectors.
That is true. You know, 1,000 francs to you might be small, but it can be a very big thing to me. You see, that's the case. And now most of the women were, due to their limitation in their finance, they cannot really pay for complete package of health expenditures. Now, what we've done is that we've created a program called Maternal Financial Access on Delivery, which is currently running in Yaoundé, in the Central Region.
Maternal Financial Access.
Yes, that is the MFAD.
MFAD, Maternal Financial Access on delivery.
Now, Maternal Financial Access on Delivery is a platform which enables pregnant women to plan in preparation for their pregnancy. Now, apart from the basic and contemporary method of family planning, we also assume that family planning can be a form of pregnancy preparation. Where it becomes a decision between the husband and the wife that this is the time we have to make a baby, and they start the necessary preparations financially and mentally. Now, financial plan becomes very necessary because the women can develop some sum of amount which they can reserve, that okay, I can develop 5,000 francs per month to reserve for my ANC till delivery. And I'll shock you that within 5 months, you'll be surprised how much you would have saved.
No, but 5,000 francs times 5 months Did you say that?
Yeah, that's about 25,000.
Yeah, but is it enough to take care of a woman, of a pregnant woman?
That was just the minimum.
Minimum, okay.
You can do more based on your income.
You could do 1,000 francs a day.
Yes, based on your income and your capacity, you can
or the willingness.
Do more than the willingness. Now, how do we enable the women to mobilize these financial resources? Those were some of the challenges we had.
Yes.
And now, since we're in the digital economy, we've advanced digital platforms with telcos and financial partners where we can enable these women develop their savings plan. We call it Je prépare mon accouchement.
Okay. You see? It's just like a kawo, we call it.
Yeah, something like that. Something like that.
A kawo is a kawo in the southwest and northern region of the country. That is, you do a daily contribution of 500 francs or 1,000 francs and so on.
Exactly.
Now, this is done through the...
No, they do use it through their mobile device.
Through their mobile device.
Yeah. Now, in the pilot phase, we had to let the women do their savings by themselves, you see, and then assess the rate of savings and impact. Now, when we started, we conducted a system with about 250 women to monitor how much they can save over time and their responsiveness. And since we have mobile savings platforms, we are in partner with Express Union Mobile Money. And
without adverts anyway.
Yeah, without
no advert.
Yeah, exactly.
Come on.
So we are trying to see how the women can use their mobile platforms to save their money in their own accounts. And
they say, okay, they can use their mobile phone.
Their mobile phones.
Right, and save in their own account.
They save in their own account.
Without necessarily moving out.
No, they don't move out.
Move out to the bank.
They don't move out to the bank.
That's wonderful.
Now, we are trying to digitalize these saving platforms to enable easy access and monitoring by the women themselves.
Can that be done by any other person except pregnant women?
No, it can be done by any other person, but for the access of the purpose of our maternal scheme,
okay.
Yeah, we've created a logical account where their savings are directed in this account.
Okay.
And they can monitor the savings over time.
Okay, now, sorry to cut you short. Okay. How will you help a woman access to get financial assistance apart from what that woman has saved?
Okay, that's what we call the pre-registration phase. When the woman is pregnant, we always advise the first trimester, which is usually 1 to 3 months. But early pregnancies are also advised to register on our platform. Now, when a woman is registered on our platform with some details about her personal information, like her name, contact number, her age of the pregnancy, and the hospital of consultation at the period. Now, we copy this data and set up in our system, and then the woman choose her hospital of consultation at the period where she is. Now, with this, we have a system called hospital assessment program, where this hospital assessment, we conducted it with the regional delegation of public health in Cameroon to have a cost analysis, a cost assessment of how much a woman will spend for a period of 9 months.
Okay.
Now, we have the average cost if the woman has to go through all her ANC expenditures.
How much delivery, can that cost?
About $100.
I don't want to.
That's true.
I know what I'm talking about. I don't want to ask because I want to find out from the women themselves. How much does it cost? Anyway, how much can it cost?
No, with the 120,000 francs budget, you are able to pay for your ANC and
from the first day of pregnancy till delivery.
To delivery. Okay. That's with simple delivery because there are different forms of.
Good. And I was coming to that. Now, the finances are limited, Svelte. What if the case has to do with ectopic pregnancy or other complications, a cesarean and so on? And you know that our doctors will tell you, no money, no operation.
That is Save My Child. That is the responsibility of Save My Child. Now, how does this work? When we have the woman registered on our platform, let me use their wife for example.
Come on.
Yeah, Miss Kedia is on the platform.
Come on.
And she's registered. At the beginning of our registration, when we receive this information, she can say she's consulting at l'Hôpital La Cantini.
Yes.
We have a cost system which assesses the actual cost of our expenditures. We send to her by SMS.
All right.
That, Mama, you are going to spend 200,000 francs at l'Hôpital La Cantini for your ANC and delivery at the different periods.
So, but this is what you have saved.
Yeah. Now, this cost forecast enable the woman to plan financially.
Okay.
Now, if you are deciding now to save 10,000 francs or 1,000 francs per day, before the period of your maturity of your pregnancy, we will send you a reminder SMS on what you have in your account and what is the expected cost of your pregnancy care, is a cost of pregnancy. Now, with this, if there's the difference between what you have in your account and the expected expenditures which you have to pay, that is where we give you a provision for you to access finance to cover this cost. Now, we work hand in gloves with hospitals to ensure that when the women are in the hospital and they are receiving treatment, and there's an additional cost which comes maybe perhaps an emergency or something, how we can limit this barrier and for the woman, the doctor to say, madam, you don't have enough money, we cannot continue medical care on you or medical support.
That's it.
So we limit this barrier. Now, on this short notice, within less than 30 minutes, we have a system that enables that the woman receive finance to cover these incontingencies. Yeah.
Now, what difference do we have between, I know of Alentef, one of your peers too, he's a young and dynamic social entrepreneur like yourself. What is the difference between Gifted Mom that Alentef runs and the Save My Child that you run?
That's very good. Now, Gifted Mom is a partner with us. Gifted Mom is an SMS platform which enables pregnant women to receive antenatal information and reminders to their next appointment with the doctors and follow up. Now, it is an advanced platform which enables complete information to pregnant women about every details of their pregnancy. Now, with this information, when you send the pregnant women the information that, mama, you have to go for your ANC for this your second trimester, you have to do this specification of tests and other follow-up. Now, the information is good. The woman receives the information. Now, payment of this the services like the ANC
is limited.
And delivery
is not there.
It's not.
And that is
where we come in.
Save My Child comes in.
Yeah. We are coming in with the financial support mechanism to enable pregnant women have access to medical facilities.
While Gifted Mom is like a reminder platform.
It's not actually a reminder, it's an advanced reminder platform.
An advanced reminder platform.
Yeah, because it is really good and it's scaled through a lot of countries in Africa and it's really helpful to our moms.
Oh, thanks very much, Svelte Moformi. We are going to come back to you. Well, just time for us to have a few messages because we have lots and lots of messages coming in. Let's take a few messages while some pregnant women outside there digest what you are talking about. Good morning to you and Abella to your televiewers. The government's strategy to hunt down ghost workers is programmed to fail. When you look at it from an ordinary perspective, competent hunters do not announce they are coming into the forest. That is interesting.
Exactly.
They want to hunt, you just hide yourself and then you aim and then you fire the animal. Well, that's creative indeed. Again, it is very stupid to tell a thief that you are coming to catch him. Yeah, come on. Do enjoy a wonderful week and God bless Cameroon. This is coming from Mayenin Mohammed from Yaoundé. That's true. Don't tell a thief you are coming. But sometimes it's good to tell a thief that I'm coming because that is why you put all those preemptive measures. Now, I see a country where real thieves move free in Yaoundé in suits and tie. Come on. Instead of those who are truly fighting for justice, instead, those who are truly fighting for justice are killed. Why? Why? He says why. We are ruled by old, wasted, sleeping minds. Head count censor in the public service is mere waste of time. We hear of this almost every year, but nothing has changed. What is the use of the audit without a mechanism to correct corruption? Manual, ancient style censor, just like Svelte was saying, will end up with the same ghost workers. People will personify into the ghost, and nothing tangible will come from it or will change. This our government has to change with the already shifted paradigm. This is coming from